Cigna is trying to get companies to rethink their employees' health with a new report commissioned by the US health insurer. The Economist finds that employers who make workforce health a priority have a higher productivity. Now, significantly fewer absences can be 23% more profitable. The report is urging employers to think long-term, beyond the pandemic, and says it's been a wake-up call for companies to engage more actively in the health and well-being of their staff. Cigna CEO David Cordani is with me. David, fascinating survey, but I guess sort of the issue is not really telling us that it's really getting companies to take the conclusions seriously.
Richard, good to be with you. It reinforces that companies have an opportunity to rethink the importance of their human capital, their most precious asset, and investing smartly in your human capital yields better engagement, longer relationships with your employees, more productivity, and as you noted, higher returns. So it's an opportunity to reinvest in your employees through that lens and viewing it as an important strategic investment.
And I wonder, though, the difficulty of doing that, and we won't necessarily, I mean, the findings are universal, even in other countries that don't have the same sort of payee structure and insurance structure. The mental health issues of COVID have been so tremendous. Would you agree?
100%, indisputable. The level of mental health, stress, strain, formal mental health needs have grown massively during the pandemic, and it reinforces, actually, if you have services through your employer, you have broader access, be it digital or live access and other support programs, but there's no doubt this is a global phenomenon.
On this question of vaccine mandates, you have an interesting, because of the nature of your business, you have basically a mandate, as I understand it, for vaccination, but you also earlier on had an incentive, $200 incentive award. Did it slightly bristle with you that you had to pay people to get a vaccine that was going to potentially save their lives?
No, is the simple answer. So when you think about employer relationship with their coworkers and benefits programs, you have the ability to use incentives and disincentives to drive certain actions or activities. But the simple answer to your question is no. What the important part is to elevate the awareness, provide broader access, and in this case, provide an incentive, not dissimilar to other health and well-being incentives that are passed through to try to get the appropriate behavior to be activated. But I think there's more positive outcomes than not in the vaccination process. Incentives are an important part of it, right. But also, as we heard with the prior employer, disincentives are also used effectively as well.
And the way in which, I mean, everybody is espousing the significance and importance of healthcare. During this pandemic, we have told it's not an economic crisis, it's a health crisis. We put the health bit right with that. I wonder, do you fear that once it's over, we go back to the bad old days?
I sincerely hope not, and I don't believe so. And the reason why is employers are yet again revisiting a basic premise. To have a vibrant, healthy, thriving corporation, you need healthy, productive, present, highly engaged coworkers. And communities are seeing that communities are more vibrant, prosperous, and have higher vitality if they have vibrant employers. Right. So they feed one another from that standpoint. So I don't think we just revert back. I think this is a supercharged event that allows us to move forward.
And on this question of hybrid working, many employers, at the height of the crisis, when everyone's working from home, said, yeah, you'll be able to work from home for the foreseeable future. We will make it hybrid. A lot of those same employers are now backtracking. Get back in the office, preferably yesterday, and let's forget this hybrid nonsense. Where do you stand?
Well, that's an employer by employer decision. So you come back to the employer's culture, operating model, business norms, et cetera. So we as an employer, we have certain coworkers that have to be on site. The nature of the work, it has to be on site. We have other employees and coworkers who their work can be and remains at home full time. And then we have a group that flexes in between. So we understand the nature of our work, but that's an employer by employer decision based upon their culture, their business model, and the technologies and tools they're able to operate with.
David, throughout the course of the program, we've been asking all guests just randomly, if you had to put something under the bed for a rainy day, I'll give you either $1, a euro, a Bitcoin, or gold. Bearing in mind, it's all about crises and financial crises. Which would you take? $1, the same value in Bitcoin, gold or a euro? Go on, which is it going to be for you, sir?
Maybe I'll buck the trend. I'll probably go with gold.
Ah, I'm afraid that's not bucking the trend. That's just about what everybody wants. I think that speaks volumes. Everybody wants gold under the mattress. It has been good to see you, sir. Thank you. I appreciate it. We will talk more about the serious issues
Stay well.
Of health. Thank you.